everybody, it's Dr. Nicole with Healing Hands in Manahawkin. I want to talk to you about something today that I feel is very important and very serious in the practice of chiropractic. We had an incident not too long ago where a patient came into our office. We did a full history, full evaluation, and upon evaluation we found that there was clinical necessity for x-rays. After taking and reviewing the x-rays, that patient was in a conversation with another chiropractor, and that other chiropractor told that patient that I took their x-rays unnecessarily. Now I'm sharing this with you for no other reason except I care about the health and safety of this community. So I want to share what real chiropractic guidelines for x-ray and treatment are. I hope that that's okay, and then I'm going to share a story with you if that's all right. Number one, chiropractors are considered primary care physicians. Most people don't know that. And we're governed by a council of people. It's called the Federation of Chiropractic Licensing Board. So those are the people that basically create our standards of care. Those are the standards that we must follow. Just like when you go to your medical doctor, there are standards of care and procedures that they must follow. Chiropractors have those same procedures and standards that they must follow with each and every patient. So I want to read to you, this just came out May 1st, 2021. This just came out, was just published by the Federation of the Chiropractic Licensing Board here in the US, and they said that the nervous system, okay, so the nervous system, which is the system in your body that controls every organ in your body, controls everything about you, is an integral and necessary component to the musculoskeletal system and subluxation complex. So if you don't remember, a subluxation is when one or more spinal bones shift out of place, causes stress to the nerve, and blocks the impulses that are traveling through that part of the nervous system from the brain to the body. If you have any questions about that, just comment below and I'll answer in more detail. Okay, anyway, they go on to say that such that the practice of chiropractic necessarily includes and shall not exclude consideration of evaluation, diagnosis, and treatment of the nervous system and its components, insofar as they pertain to the established chiropractic science and philosophy. So what does that mean? Well, that means when a patient walks into our office, we are required by our governing board of chiropractic to do a complete history, a complete evaluation, and if upon evaluation we find clinical necessity such as decreased range of motion, neurological deficit, orthopedic positive findings, deficits in posture, things like that, X-ray is a very acceptable form of diagnosis. Now, they also go on to say that the use of radiographic imaging in the patient care is at the professional judgment of the treating doctor, okay, of chiropractic. So what does that mean? Well, that means that we are qualified to determine if a patient needs an x-ray, when to take it, and when it is clinically appropriate. Now, if the adjustment of the spine directly impacts the nervous system, the spinal cord, and the nerve roots that exit the spine, if that a chiropractic adjustment directly impacts your nervous system, wouldn't you want your doctor to do his utmost diligence in finding and being able to see exactly what is causing your condition? I mean, it's affecting your central nervous system. So I'm going to share a story with you guys if that's okay. My best friend, who has a son who's an athlete, and she called me up because her son was having numbness and tingling down his arm. And in her mind, it was a chiropractic problem because he was a pitcher. And it just made sense that he probably had a bone out of alignment in his neck that was impinging on the nerves that feed his arm. So she's not local to my area, so I sent her to a chiropractor in her area, and thank God that chiropractor took x-rays before the treatment. Because upon the x-ray, upon evaluation of that x-ray, the chiropractor found that my friend's son had a tumor in his neck that was impinging on the nerves going down his arm. And had that chiropractor done an adjustment without taking that x-ray, God only knows what would have happened to my best friend's son. So I share that story with you because x-ray is a vital component to determine the safety and the correct treatment for patients that come into a chiropractic office. So as always, I want to hear your thoughts on this. If you've had any experiences with chiropractors who do take x-rays, who don't take x-rays, share your experience below, because I hear this all the time in patients that come into the office. Share your experience below. Of course, if you have any questions, ask in the comments, show us some love, because we welcome those, and we want to make sure that chiropractic care is available for all of you, but we also want to make sure that it's done correctly and it's done with a standard and it's also done and it's completely safe for you. Okay, we love ya.